Hello and welcome everyone to tonight's webinar on the My Rights, My Decision Toolkit. This webinar is brought to you by Capital Health Network and the ACT Mental Health Consumers Network. First, I would like to acknowledge the traditional custodians of the land we are meeting on. I acknowledge and respect their enduring culture and the contribution they make to the life of this city and this region. I pay my respects to their elders past, present and emerging. I also acknowledge and welcome other Aboriginal and Torres Strait Islander people who might be attending tonight's event. I am Dr. Leonie Harcourt, a GP Education Advisor at the Capital Health Network. Also with me tonight is Kunal Mohiti, the Events Lead at Capital Health Network, and of course our wonderful speakers, Petra Calais, the Community Education Coordinator at ACT Mental Health Consumers Network, and Terry Warner, an advocate and researcher who's been closely involved in the mental health space for many years and in the development of the My Rights, My Decision toolkit. Just tonight, all participants have been muted and we love questions. So please type the questions into the Q&A section and not the chat box of your Zoom window. And we'll have a question and answer session after both Terry and Petra have presented. The presentation itself will be uploaded to the Capital Health Network YouTube page and you're welcome to share it with your networks. Regarding CPD hours, please fill in the post-event evaluation survey that CHN will send to you. CHN will email you a certificate of attendance after the event, and please feel free to self-report 1.5 hours of educational activities to your CPD home. So, onto our presenters. Tonight, we're very lucky to have Terry Warner and Petra Calais. Terry has worked in the mental health sector for over 10 years in policy, research and training roles. She's been involved with the My Rights, My Decision program since its inception as a peer facilitator, delivering training to consumers, clinicians, and mental health service providers. Petra is the Community Education Coordinator at the Mental Health Consumers Network. She's a qualified educator, has worked in the community sector training, design and development for over 20 years, including the past 10 years, focusing on mental health consumer education. So over to our presenters. Thank you.
Thank you, Leonie. Before we get started, we're just going to launch a brief poll because we'd really like to get a feel for what do people already know about the My Rights, My Decisions form kit. So you'll notice the form kit, the poll's going to come up. Just if you could answer, have you heard of the form kit before? And have you been involved with some form of advanced care planning in the mental health space before, whether that's using the forms on the Canberra Health Services website, or maybe the forms from the previous Mental Health Act, or the actual form kit itself. So we'd love to see what your comments and thoughts about that are. And I have minimized my poll, so I can't see anything to do with the poll at the moment. I don't know if you can, Terry.
Yeah. So we've got most people have not heard of it, and therefore they haven't used it.
Excellent.
Yeah,
cool. Because I don't know why I just can't see the poll now. So hopefully, oh, excellent, great. So hopefully the information tonight will be useful and enlightening. And to get us started, Terry's gonna introduce the training.
So from the poll, it's pretty fair to say that if a consumer walks in and asks you to help them with this, which unfortunately is a bit blurry, you might not know what to do. Now, the 2015 ACT Mental Health Act has 3 rights-based instruments written into it that people can put in place to ensure that their wishes and preferences are known in terms of their mental health treatment, care and support if they don't have decision-making capacity while they're in hospital or under a treatment order. The form kit is one way that these things can be put into place. During this session, we'll walk you through the what, the why, and the how. So what the My Rights, My Decision form kit is, why it's an important tool and how it can support consumer decision-making and recovery, and then how to complete it. Specifically what the GP's role might be in the process so that people can put those 3 rights-based instruments, which are the advance agreement, advance consent direction, and nominated person, into place for themselves. Throughout the workshop, you'll often hear us referring to the terms consumer and treating team. In this context, when we're talking about a consumer, we're talking about someone who under the Act has a lived experience of mental illness or mental disorder, so someone who's subject to the Mental Health Act. Within the legislation, they talk about 2 different groups of mental health professionals as the treating team. The first one is the person's regular team, such as you as their GP, and the other is the team that will treat the consumer if they have to go to hospital. And obviously each has sort of slightly different responsibilities with respect to these instruments. Now, Petra, were you going to share a presentation? I've just realised it's not coming up on my screen.
No, that's at the end. Oh, I thought I was sharing. Sorry, I just realised I was sharing and it's for some reason it stopped sharing. Is it sharing now?
Fantastic.
Okay.
Yes. So what is the My Rights, My Decisions form kit and why is it important? First, it is a legally valid way of putting those instruments into place. So it's a legally valid set of forms that can be used to nominate a nominated person or to put an advance agreement or advance consent direction in place. But this form kit was developed in consultation with mental health consumers, with the Health Directorate, with the ACT Disability Aged and Carer Advocacy Service, with Mental Health Carers Voice, Legal Aid, and also the Human Rights Commission. The kit supports consumers to express their views and preferences about their mental health treatment, care, and support. And in doing so, it helps treating teams achieve better outcomes for the people that they're working with. What we'll do now is we'll take a look at each of the provisions in turn in the order that they appear in the form kit. And then later on, we'll discuss what's involved in completing the forms. If you have a copy of the kit in front of you, you might want to follow along with it. Now, the first part of the kit is the nominated person form. A nominated person is a person who I trust to present my views if I need treatment, care, or support. So this might be a friend, a family member, carer, or kin who can help with decision-making if I become unwell. It can't be a paid carer or support worker. The role of the nominated person is to ensure that my interests are respected, to receive information about my treatment, care, and support, and to be consulted about decisions that relate to me. A nominated person does not have the power to make decisions for me or to give consent on my behalf, but they can support the treating team by relaying my preferences and also to assist in matters that are described in the rest of my Rights, My Decisions form. So again, a nominated person is not a substitute decision maker. It's also not the same as a carer. A carer is defined separately under the Act and has specific rights and responsibilities, but they don't automatically become my nominated person. To become a nominated person, that person needs to be at least 18 years of age. They need to be able to undertake the functions of a nominated person, and they also need to agree. So let's take a look at an example. We have Blake. Now, Blake chooses Avery, who is a close friend, to be their nominated person instead of a family member. Avery has been very supportive as an advocate in the past and agrees to take on the role. They then discuss Blake's wishes about treatment and care before signing the form, and Blake would then book a long appointment with the GP to discuss the form kit. The next provision is the advance agreement. Now, an advance agreement records a person's decisions about everyday matters. That includes practical arrangements, like who will look after the house and pets, and also includes any relevant information, like languages that I speak, cultural or spiritual traditions, and any other illnesses or health conditions that I might have. It also includes contact details for people like carers, guardians, legal representatives, the person who checks my mail, and also the nominated person. Now, an advance agreement doesn't include information about medication or treatment consent, or who I want information about my treatment shared with, because that information is included in the advance consent direction. A good way to think about it is if your patient knew they were going to be away from home for a while, but didn't know how long, what would they need to put in place to make sure everything at home goes smoothly? And what would they need at the place they're going to in order to feel safe and comfortable? The preferences stated in the advance agreement are discussed and agreed between the person and their support team. And that includes the people who provide practical help, the treating team, and other important people in their life. A close family member, a nominated person, a carer, or a significant other can also help the person develop their agreement. Now, an advance agreement is not a guarantee. If any part of an advance agreement can't be followed, the treating team needs to note the reason in the consumer's clinical record. So here's another brief case study for you. Jordan lives alone and has 2 pets. Jordan had a recent stay in hospital and was really worried because there weren't any arrangements in place to look after those pets or to manage the bills or collect the mail. After returning home, Jordan decides to complete an advance agreement to record what practical things need to be looked after if Jordan ends up in hospital again. On top of that, Jordan finds that taking a shower or doing some breathing exercises is helpful during stressful times. And Jordan also records that in the advance agreement so that the treating team knows that's an option if Jordan doesn't feel able to communicate it. The third part of the kit is the advance consent direction. And the advance consent direction is the most medico-legally significant part of the kit because it deals with treatment and contact preferences. In it, a consumer can record what treatment, care, and support they do and don't consent to, and what medications or procedures they do and don't consent to, including electroconvulsive therapy. They can also record who they do or don't consent to receive information about them when they have reduced decision-making capacity. So the advance consent direction upholds a person's right to informed consent and to refuse consent to treatment if decisions need to be made at a time in the future when they're assessed as not having decision-making capacity. The advance consent direction is a legal document that's only valid in the ACT and is not recognised in other states or territories. So let's talk a moment about Cameron. Cameron has had a bad reaction to a common medication in the past and is concerned about it being prescribed again. Cameron and their doctor talk about options for treatment and care and then record them in the advance consent direction, including that Cameron does not consent to having that medication prescribed or used in their treatment. So those are the 3 parts of the kit. But why use it? What's the benefit of the form kits and why should people complete them? I'll hand over to Petra to talk you through some of that.
Okay, sorry, I just have to turn my camera back on. Okay, so why do this? Basically, there are 2 reasons. One is that these are a legal provision under the Act, and the second one is that they are designed to get better outcomes for everyone. So let's talk briefly about the Mental Health Act. The Mental Health Act in the ACT seeks to comply with the Human Rights Act and the United Nations Convention on the Rights of People with Disabilities. So it's designed to give people a better opportunity to make decisions about their mental health treatment, care, and support. And in line with that convention, the Act requires consideration of a person's views through supported decision-making and respect for their will and preferences through advance agreements and advance consent directions. Under the Act, a person with mental illness or disorder must always have the opportunity to make or contribute to decisions about their treatment, care, or support. Their carers, kin, family members, and friends have the right to be involved in supporting them to make these decisions. And they're assumed to have decision-making capacity under the Act unless it is assessed that they do not. So we're going to explore the concept of decision making a little bit more in depth a bit later, because it's very important in relation to these forms. So in the Act, consumers also have the right to get information as early as possible and in a way that they can understand, and speak for themselves and have support to speak for themselves if they need it. For example, having an interpreter, a nominated person, or a support person. So apart from decision making, supported decisions are also a very important part of the Act. So how could completing this form kit be of benefit to patients or consumers? The kit gives them a way to let their views, wishes, and decisions be known in advance. Those decisions then have to be taken into account by the people providing treatment, care, and support, even if they have reduced decision-making capacity at the time. So it supports decision-making, recovery, freedom of choice, and having more control over one's life. So by supporting consumers to express their views and preferences about their mental health treatment, care, and support, it also helps treating teams to achieve better outcomes for people they're working with, so that consumers can get care they need at a time they need it. So let's get to the nitty-gritty. How do we actually complete these form kits? How can you support a consumer who approaches you with a form kit, or who you might think might benefit from completing one of these form kits? So first of all, remember that the consumer does not need to be well to fill out the forms. A consumer can be acutely unwell and still have decision-making capacity. They do not need to fill them out in your presence, and you should not fill them out yourself unless the consumer agrees for you to scribe for them. A consumer does not have to be 18 to put these forms in place, but we do not know if an advance consent direction signed by a GILIC competent minor would be legally valid. So what to do? First of all, encourage consumers to plan for future decisions through using the My Rights, My Decisions form kit. Consumers may choose to complete 1, 2, or all 3 forms that form the kit. In each form they choose to complete needs to have all the relevant signatures before it can be submitted. Advise the consumers to book a long appointment when coming to finalise their form kit, because this isn't something that can be rushed. And when consumers present with a drafted form kit, review the draft and discuss any concerns you may have. You need to affirm that the consumer has decision-making capacity when you sign the forms, and each form has a checkbox as a reminder of this requirement. The forms do not expire once submitted. They're in place until they're withdrawn or replaced with new forms. So encourage consumers to review their decisions regularly to ensure the information stays up to date. And consumers have the right to withdraw their forms at any time when they have decision-making capacity, either verbally or in writing. So a bit more about decision-making capacity. Consumers are always to be assumed to have decision-making capacity, unless it has been determined through an assessment that they do not. If you are concerned that a consumer does not have decision-making capacity, consider suggesting that they make another appointment and bring a person they trust to support them. In order for these forms to be valid and put into place, a member of the treating team, or in your case you, needs to agree and sign off that the consumer has decision-making capacity. So what does that actually mean? There is information about decision-making capacity that you can search for on the health website, but these are some of the main principles. Under the Act, consumers are always assumed to have decision-making capacity. Decision-making capacity is situational and decision-specific for that particular decision. So it's not an all or nothing thing, and a consumer may have decision-making capacity in relation to one decision, not the other. So it's what's happening on this day for this appointment for this particular decision. If the people providing treatment are worried that the consumer might not have capacity, they can do an assessment check. Consumers must be supported to make decisions about their treatment to the best of their ability. Supported decision making means you can help them make decisions about their treatment, care, or support. This may include giving them information in different ways, for example, using an interpreter or a translation service, or involving other people that the consumer trusts, such as a family member, carer, or close friend, to help them understand and make decisions about their treatment and care. Decision-making capacity can only be assessed by a health professional within their scope of practice. So you may be the only person the consumer sees regularly who can sign the forms from that. A person has capacity to make decisions under the Act if they can make and communicate a decision with assistance if needed. So this would include understanding when a decision about treatment, care, or support needs to be made, understanding the facts that relate to that decision, understanding the main choices available, weighing up and understanding the consequences of the choices, and then making and communicating that decision in whatever way they can. So just being aware that patients can make as many drafts of the form kit as they like, whenever they like, but you should not sign the form if you're uncertain about the decision-making capacity when you're asked to sign it. So how to submit the form kit? It's good to keep in mind these provisions don't need to follow the exact format in the form kit to be valid, but they do need to be signed properly. For many people, it will be easier to use the existing form kit to put them into effect, because then people are sure that it's completed properly. So once a consumer's form kit is finalized, these forms need to be properly signed for the parts that are completed. And in the form kit, there is a signature checklist on page 16, and there's instructions for clinicians on the very last page of the form kit. It's important that the forms are easily accessible to health professionals and the support people who are listed on it. So we want to keep a copy of the forms in their clinical record, and then provide a copy of the forms to relevant people as well. And then if the consumer agrees, send a copy to Canberra Health Services for uploading to the digital health record. And there is an email address on the form kit, so that that way the document can be easily located. We also recommend to copy the consumers into that email so that they have a record of it. So it's important that it's easily accessible for everyone, so it can actually be used when it's needed. And then once a consumer has this form kit, it's important then to provide mental health treatment, care, and support in accordance with the forms as set out in the Act, and provide the forms with any referrals to hospital. So let's have a quick look at each of these forms in turn. So to be valid, the nominated person form, which is on page 4 of the form kit, must be signed by the consumer and the nominated person. The advance agreement form, which starts on page 5, needs to be written down. It doesn't need to follow the exact format in the form kit to be valid, but it's often easier to use that form. It does need to be signed by the consumer and the treating team representative, for example, GP. If the consumer has a nominated person, they should also sign the advance agreement. And if there is anyone else, another person likely to be providing practical help, they can also sign it. Once signed, a scanned version of this should be attached to the DHR so that the document can be easily located. And if the GPs generally don't have access, they would need it to email it in order for it to be scanned. So here we've got another example of Blake. So we've heard about Blake and Avery before, but once Avery has been appointed as Blake's nominated person, they go together to the GP to finalize the advance agreement portion of the form kit. Blake, Avery, and the GP sign the form kit, which is then emailed for uploading to the digital health record, and Blake gives Avery a copy of the form. And the third part of the form kit is the advance consent direction. And this is on page 11 of the form kit. So in order to be valid, this needs to be in writing and signed. And a consumer can only complete an advance consent direction if they have decision-making capacity and they have consulted with their treating team about options for treatment, care, and support in relation to mental disorder or mental illness. And because this is a legal document, this form is a bit more complicated. Each of these forms just get slightly more complicated to sign. So in order for this form to be valid, there are two different options. If the consumer consents to electroconvulsive therapy, there's one option, and if not, another one. So if they don't consent to ECT, the form needs to be signed in the presence of a witness who is not part of the treating team, by the consumer, the treating team representative, which would be the GP likely, and the witness, who must countersign both signatures. And this witness needs to be an adult who is not part of the treating team or the person's carer, nominated person, power of attorney, or guardian. If the advance consent directions does include consent to ECT, it must be signed in the presence of two witnesses who are not part of the treating team. So it must be signed by the consumer, the treating team representative, the GP, most likely, and the two witnesses who must countersign both signatures. Again, the witnesses must be adults who are not part of the treating team, carers, nominated person, power of attorney, or guardian. And a consumer does not need to fill out the ECT sections of the advance consent direction for the rest of the form to be valid. So Terry's going to tell us a bit more about what to do next.
Okay, so it's important that the form kit is easily accessible to the health professionals and the support people who are listed in it. And a member of the person's treating team, so the GP or the psychiatrist, needs to ensure that each completed My Rights, My Decisions form is entered into the consumer's Canberra Health Services digital health record and sent to the other members of the treating team. Now, for a GP, that looks like emailing it to the tribunal liaison email address, which will then have it put to the person's MyDHR. Copies of the form kit need to go to the person themselves, the consumer, the nominated person if they have one. A copy should go to the person's carer if the consumer has one and consents to it. The consumer can actually choose whether someone who's a carer under the Act has access to the form kit. And it also needs to be sent to the person's guardian if they have one. It needs to go to ACAT. Again, that happens through sending it to the tribunal liaison email address. And also if the person, when we run our sessions, we run sessions where we educate consumers about My Rights, My Decisions form kit and help them to sort of think about how they would put it in place and how they might want to fill it out. We provide them with two additional ways of indicating that they have these forms in place. The first is a little key ring. And the second is a little wallet card. And we have these in case the person's forms can't be found in MyDHR, because in an emergency situation in particular, the treating team only needs to make reasonable efforts to find them. But it might be more important to the consumer that they're found than the emergency sort of calls for. So this means the consumer can actually indicate, hey, these forms exist and are available and are important, without the treating team needing to go to great lengths to try and find them if they're not immediately accessible on MyDHR. So the keyring has space to write some important contact numbers for a person, like their nominated person or an emergency contact. And the wallet card has room for a little bit more information. So there's lots of space for whatever the person might think is important to add, and also a little bit for adding in just what helps the person when they're stressed. Because if you are distressed and you find yourself in hospital and you're finding it difficult to make decisions, you can also find it a little bit tricky to think about, well, what actually helps me when I am distressed? It's a good reminder for the person. It also is a really useful tool for whoever might be supporting them in that moment. There are some things, again, that are really important to keep in mind. The first is that these forms are limited to the ACT. So if the consumer is admitted to a hospital in another state or territory, these forms don't have the same legal power. Again, they need to be signed correctly to come into effect. They do not count if they are not signed and countersigned as is set out in the Act. Crucially, nothing in any of these forms will override a clinical decision to seclude or restrain someone while they are an inpatient. It's really important that you're clear about this so that consumers know what the limitations are. The forms do not expire. They need to be replaced with new forms to update the arrangements or formally withdrawn to cancel them. So it's really important to review the forms regularly to ensure the information stays up to date, because otherwise they just stay there forever with potentially out of date and inaccurate information. It might be helpful to trigger a review after the person's treatment, care, or support needs have changed, or after the consumer had a period where they were unwell and the form was used. It's also quite helpful for me as a consumer to set a reminder or make an entry in my own calendar to update it once a year. And a GP could help that by thinking, well, maybe if I have a mental health care plan in place, when that needs to be reviewed, that might be a good time to also review these forms. Any update needs to follow the same process as the original forms and will need to be signed correctly to be valid and to act as replacements for the forms that are already in place. If there are no changes made, you should still make a record of this so that you know that you've had the conversation and reviewed it and made the active decision not to change anything. So what next? Download and print. Or you might identify a consumer who would benefit from it. And if you do have a patient who you think it might be a good idea for them to put these forms in place, consider when you might discuss it with them. So again, the mental health care plan review is a good time to bring these sorts of things up. Or if you receive a discharge summary because they've spent some time in hospital, that also is a really good time to start talking about, well, what happened then that you might want to have happen differently next time. And this is one way that you can make sure that what you want to have happen is known and understood and taken into account if you do find yourself in hospital again. And then also consider what other support someone might need to draft their kit, so it can be done without needing to schedule a lot of unnecessary appointments. You can refer them to Head to Health, or you can also keep an eye on when we're running consumer workshops, because that's a peer-led space where we can support people to understand what the forms are for and how they might fill them out and what might be useful for them to include. Again, you can also go to our website, which is actmhcn.org.au, where you can get fact sheets about the form kit, and you can also download and print the form kit. It is available in a writable PDF. So you can type in the person's responses, or they can type them in, or it can be printed out and handwritten. All of those are valid, provided that the correct signatures are in the correct places. And just before we start a bit of a Q&A, when we were going through this process of designing and developing the My Rights, My Decisions form kit, we talked to some clinicians about why they thought My Rights, My Decisions was important and why it should be put in place. And Petra has a bit of a video that I think she's going to play So we can
Sorry,
hear, right, do we? Do we have a little video that we're going to play?
we do, but it's at the moment, PowerPoint has frozen. Okay, and I just realized I don't think I shared sound, so I'm going to just reshare it with sound. All right.
Under the new mental health legislation in the ACT, we have a far more capacity-based look at the way the system should operate. So being capacity-based means that when they're going in to seek assistance or when they're coming in for treatment, it's assumed that they have the capacity to make decisions unless it can be proven otherwise.
It's so much better if people can actually have a say, because the person who knows their condition best is the person that has it.
Well, I think it's important to know your human rights, that you do have human rights. Everyone's got a voice, no matter how soft that voice is or how unheard it is.
And I think often there can be a bit of a trap when you're in the mental health system and you can have things done to you. And this project actually flips things a bit.
The Mental Health Act before 2015 was subject to a very large review so that there was more say people could have over their future treatment, but also looking at how, even if someone was receiving treatment involuntarily, that their capacity to consent were also taken into account before any order was made about that involuntary treatment.
The three new provisions in the Act are three very important provisions in the Act that promote autonomy and allow the consumer to have a say in their future treatment.
And these are all things that are enshrined in the Act and give them opportunity to direct that sort of treatment, care and support that they might want. And I think that those are very important, because to be able to make those decisions prior to being unwell is very important.
I mean, what it's saying is that the person makes as many of the decisions that concern them as are possible. And where there are any gaps, they're supported with extra information or extra support to make those decisions. So it's very much a partnership.
So by putting an advance agreement in place, you can actually say what you want to happen with your children and your pets and other things that aren't related to mental health treatment. And you can put those things in place when you're well, so that when you become unwell, those things are already in writing, and the treating team that when you go into hospital knows exactly what needs to be done and who to contact and who should be looking after your pets and your children and your plants and other things that are important to you.
It's quite empowered for people to be able to actually articulate how it is that they want to be treated, what kind of medications, treatments, etc. that they would prefer to be treated with.
It gives me the choice and the control of my life. I don't have the closest family on that front, and there had been times where they've made phone calls to my family without my permission and things have erupted. If you have an advanced agreement, then your needs, your choices and decisions could go your way just by having that document.
Without this information, the health workers are in essence guessing who the consumer would like to be involved in their care. And that's going to put more stress on consumer, and that will affect their recovery. And then also it's affect their trust and relationship with mental health. It's not only with mental health, with any health services actually. reduce the stress level of the consumer, at the same time reduce the stress from us as well, because we are doing the right way things.
These tools are there to help staff just as much as they're there to help consumers. I think that the workshop and the toolkit is really valuable for staff, particularly in the acute mental health settings. While people are unwell, if you treat them in the ways that we know work for them or that they know work for them, they're far less likely to become more unwell on the basis of receiving types of treatments that don't work for them.
It's written in a language that's easily understood, and it's more accessible in terms of that these documents can be found quite easily and publicly. First, the actual paperwork itself may take a bit longer, but at the same time, it has important benefits for both the individual, obviously, in terms of ensuring that their rights and decisions are respected, but also in terms of the clinical staff. It provides a mechanism to start a conversation, and then it fosters good engagement between the individual and the mental health service, and therefore that all promotes better outcomes for the individual. As a service provider, it supports us because it makes us more aware of what that person wants, and make sure as closely as possibly as we can, that we respect those wishes and we follow through with that, and holds us to account as well. In terms of challenges, I would say probably the largest one has been trying to raise awareness. Occasionally we get the comments such as, I'm not sure which form I should be using, whether I should be using the My Rights, My Decision toolkit or using the forms that previously existed. Prior to the change in the Mental Health Act and the My Rights, My Decision toolkit, what we noticed was a very, very low uptake of instruments such as an advance agreement. Prior to that, what we've noticed definitely is a gradual increase in uptake of those documents and those processes.
We provide them with information, by interacting face to face with the patient. So it takes time, and we usually do it like in a step by step. So if there is nominative person, advance agreement, advance consent direction, whatever it is, then we offer them one at a time and see what you think important for you.
The first thing I would suggest is about being open and flexible. Sometimes you have teething issues and processes need to be refined over time. When issues do arise, I think it's important that staff report them back so that we can actually refine those processes so that we can make it easier. And we also need to be receptive from feedback from the people who are actually using these toolkits. We need to be responsive to their requirements because ultimately it's there to serve them. The best thing we can do as a service is actually make sure that we've first of all got the awareness of our staff on the ground, that actually aware it exists. That's obviously key, but also then beyond the awareness is then actually promoting it. So then having that conversation with the individual, if you've completed your toolkit, can we have a copy? Can we upload it onto our system so it can be easily found and is accessible? We need to raise the awareness because we need to acknowledge that probably at this point in time, not every staff member across our service is aware of the My Rights, My Decision toolkit, but also beyond that, once we do have that awareness, is making sure that it becomes a part of our vernacular.
Person themselves, the consumer, is part of that treating team. So together, they can work together with doctors, psychologists, social workers, nurses. They can all work together towards ensuring that the person has the best experience, particularly in an inpatient facility, that they possibly can, bearing in mind what their views and wishes are about their treatment, care and support. Very important.
If I wasn't making my decisions, then decisions would be made that I would probably be not in agreement with, but making it myself is exactly what I know, what I need and what I would like to happen.
Okay, so just a quick recap on what we've covered. What we're talking about is the My Rights, My Decisions form kit, which is a consumer designed version of the provisions and instruments under the Mental Health Act that is fully compliant with the Act. So the advantage of it is that it is a bit more consumer friendly than a clinical form or some of the other varieties that are out there, but it is fully compliant with the current Mental Health Act. And this form kit, when put in place, will have the full force of the Act. And the reason that you'd want to do this is because it meets those legal obligations and it leads to better outcomes for people who put them in place. And you can do this by following the advice that we've given you in this webinar or having a look at some of the fact sheets that we have available on our website. We're also very, very contactable if you have more questions. And now I think it's time for us to open it up to some questions from the audience if there are any available. Or Leonie, if you have questions, you're also very welcome to weigh in.
Thank you. I found that really very informative, and as you were talking, I was kind of bouncing between the form kit and the things you were saying. And I can just say that it is set out very clearly that even I could understand it and follow it through. So thank you for that. I just thought I'd kick off with a question of my own. And so I just wanted to clarify, you mentioned that it is compliant with the Mental Health Treatment Act, but then you also said that I imagine this is more with the advanced consent direction form, the wishes can be overruled by the clinical team. So how do you explain that aspect to the patient?
Oh, it is a tricky one. So the specific, I think the specifics of what you're talking about were when I said that it doesn't override a clinical decision to seclude or restrain someone, because those are separate powers under the Act.
Right.
So, and it's unfortunate we have not reached a point in our understanding of mental health treatment where inpatient services will rule out restrictive practice.
Yep.
So when the Act was put into place, it was a non-starter. They were never going to allow these instruments to protect a person from seclusion and restraint because they felt they had very strong clinical reasons why those things might need to happen.
Yep.
The flip side is that there are certain protections in place for other areas where the forms can potentially be overridden. So with an advanced consent direction, as I said, it involves treatment, consent to treatment, consent to medication, consent to electroconvulsive therapy. If I fill out an advanced consent direction and I say I consent to olanzapine treatment, if I'm then under a treatment order, irrespective of whether I'm deemed to have decision-making capacity, if I say I refuse, or if I reverse my decision, then ACAT has to decide whether my original paperwork or my decision in the moment
is the one
is what prevails. So it actually isn't. It's taken out of the treating team's hands in a sense, because I've provided what's effectively a health direction specific to my mental health that says I do not consent to being treated with olanzapine.
But previously you've consented to it. Yeah.
Yes, exactly. Yeah.
Yep. So similarly, like could someone who says I don't consent to ECT and then they're given ECT because the treating team is unaware that the person has My Rights, an advanced consent direction form, could if they're given ECT and they have put that they don't consent to it, what happens in that situation?
That is a question for a lawyer.
Okay.
Unfortunately. And the ECT provisions under the Act are very specific and they're very restrictive for a reason, because emergency ECT orders, so being compulsorily given ECT is only meant to happen almost as a life-saving measure.
Yep.
So the Act is written in such a way that you can't just sort of propose ECT.
Yep.
There are a lot of protections in place around it, and the specifics of ECT in an advanced consent direction are again so way medical legally beyond me. But it is very useful still to have those protections in place.
So are the mental, sorry, everybody in the audience, I'm dominating the questions, so please type them into the Q&A because you'll get bored of hearing my questions. But are all the mental health units aware that they have to look on the MyDHR for an advanced care directive when someone's admitted? Are they all, do they know that?
So it's written into their procedures that they are supposed to, whether one of the steps is they make reasonable efforts to determine whether these forms are in place. And hopefully what's happened is that they've been scanned to a PDF and they've been put up on the MyDHR, and whoever put them on MyDHR ticked the right boxes and pressed the right buttons. Under the previous patient administration system, people sometimes forgot to tick the box. Which then meant it was on the consumers, which is why we put in place we give people the key ring and we give them the wallet card, because that way they can kind of go, no, they are there. They are there, they do exist, and you need to think about them, and they do need to be taken into consideration at all times.
And so just to reiterate to the audience, the way to get it up onto the MyDHR is to email it to the tribunal liaison email address.
Yes.
So that's how you get up onto MyDHR. It would be good, just kind of pie in the sky stuff, but a lot of the ACT Health referral forms are on the smart form. So if there was a smart form for that had the maybe the advanced consent direction form and the advance agreement form on the smart forms for ACT Health, that might be a good thing. What about in discharge planning, do you know if the mental health units are kind of flagging this for people when they're being discharged?
It can be a bit fraught when someone is an inpatient, because often the focus is, well, we need to sort of stabilize you and work out what treatment is. So a person can, while they're still an inpatient, they can start filling out these forms if they're available. And we've done quite a lot of work providing in-services to the inpatient and also the community teams to make sure that at some point, someone in that sort of treatment continuum is saying, hey, this is an option, why don't you think about this?
What about for the consumer who doesn't really have a usual GP, so is fairly isolated, because that's a scenario they might not have a nominated treating person that they trust, they might not have that community support to do the advance agreement form, they might not have a relationship with a GP at all. What's their kind of, would they go to Head to Health or to the Mental Health Consumers Network? What's their kind of path?
I might
so they have
Terry, is that right?
Okay, that's right. Sure.
We just had a whole group of staff from Head to Health come and do a Train the Trainer program with us in order to be able to support people to complete these forms. And they emphasized quite a few times, please refer people to us. That's what we're here for. We're there to help link people up with the types of services they need. So apart from supporting someone with the form itself, they will support to try to link them up with medical services, because it is something we're aware of, that it can be challenging for people who don't have a regular GP. Sorry, Terry, keep going. I just thought I'd mention that because that happened just recently.
Thank you.
And so what I was going to add there was that really what it comes down to in terms of the role of the GP is that affirmation that the person has decision-making capacity. So they can fill out the forms and get them to the point that they're happy. There is I think the advanced consent direction does require you to consult with someone who is with a health professional about your treatment decisions. So it's about the treatment decisions you've written out in the form already and whether they might need some changes or whether they're appropriate, and then whether the person has decision-making capacity at the time the forms are being signed. So because there are other ways they can kind of get supported to fill out the bulk of the forms, then while it's absolutely the best thing for them to have a regular GP, the role of the GP can also be quite specific to those functions of meeting the requirement under the Act that the person consults with a health professional about treatment decisions, and also that they have decision-making capacity at the time they're being signed.
Yep. So there could be the scenario where you see a patient for a second time or something, and you're the GP that completes that, assuming that assessing capacity to make decisions. Yes, assuming that that's kind of quite apparent on your first or second meeting.
Yes, yeah. And I suppose the other thing that I think I want to sort of highlight is that the advanced consent direction, sorry, I'm talking about the advance agreement. I can put in what it is that I would like to have happen, and as I said, but it's not actually a guarantee. So anything that I write in the advance agreement, I can say this is, in a perfect world, this is what would happen when I go into hospital. If it can't happen, then it can't happen.
Yep. Yeah.
But previously, if it couldn't happen, it couldn't happen, and that was the end of it. I never got an explanation.
Yep.
What's changed is that now, if it can't happen, someone who is part of my treating team while I'm in hospital has to make a note that it didn't happen and why.
Right. Yep. Yep.
Which is quite an important shift, really, because it used to be, I need this. I know I need this. We've talked about me needing this. I didn't get it. I don't understand why. And now, I've lost trust in the system because these are things that I definitely need to have happen while I'm in hospital. But now it's like, oh, okay, I know why it didn't happen. It didn't happen because of these reasons.
Yeah. Just going on to signatories or witnesses for the forms, you mentioned that they had to be 2 witnesses that were not part of the treating team. Do practice receptionists or practice nurses count, or because sometimes you want to just get a witness from somewhere?
Provided they're over 18, I think they do. Again, I disclaimer, not a lawyer.
Yeah. Petra, do you know?
Our impression is that, and in many situations that's likely to be a witness. So I think as long as it's not somebody providing medical treatment or care to that person, and so not a member of their actual treating team.
So the practice nurse might be a bit kind of on the fence about that.
Maybe. So probably reception would be better just because of that.
Yeah.
Yeah. The intention is, I think, to avoid coercion.
Yeah.
Because if the witnesses are members of the treating team and the doctor also signs that the person consents to ECT, then the question starts to be, well, does the person consent, or was the combined clinical power of the 3 people who co-signed a factor in them consenting to it?
Yep. Yeah, that makes sense. And you've mentioned that changes to the form and to update them. So sometimes you have situations where people are in and out of favour quite a lot. So, within a year, they could be the person you contact, then they're not the person you contact. That seems like it'd be quite kind of appointment heavy for the patient to keep on having to make long appointments to discuss changes. And sometimes long appointments are not available. So that could be a bit of a challenge.
Yeah, that's a fair point. And I suppose if you have a regular GP you have a good relationship with, then you wouldn't necessarily need a long appointment to make a small change like that.
Yep.
And it would, I guess, be up to the GP as to whether that was a short sort of single issue face-to-face appointment, or whether that could be potentially a video telehealth sort of thing. So I think there's potentially some discretion there.
Yeah.
So it doesn't always have to be a long appointment. It's just that in the first instance, if they're going through all 3 forms and you do need to read it and have a quick discussion about their treatment decisions, then that's going to take a lot longer than a short appointment is going to allow for.
What do you do in the situation where a person doesn't have a big community to take out the bins, to look after the pets, to water the plants, to pay the bills? Is that the public trustee who would look after that?
That's a question above my pay grade.
Yeah, right.
And also, it's a question that I'd be really interested in getting an answer
Yeah.
to, because that's sort of the situation that I often find myself in. I don't have a great deal of family in Canberra. I live in an apartment complex where we don't really sort of talk to each other. So you're right, it could be like quite difficult for me to get the people to actually do the things that I need done while I'm in hospital.
Yeah.
So I would I know that we have, or we used to, Petra, have a way of putting these questions to people who are above my pay grade. And if we still have that mechanism, then we can actually ask that question and come back with the answer for you.
Yeah.
Because again, I want to know the answer as well.
Yeah. Yeah. Okay, I think I've probably asked enough questions. So last chance for the audience members. We have got two very, very informed, useful experts on the screen. So it's not always you get such direct access. And thank you very much for being so thorough, enthusiastic, and logical with your presentations. So if there are no more questions, I'll just give everyone a minute or two. We'll wind it up. And just to let everyone know that we're going to put the recording on the YouTube channel, our Capital Health Network YouTube channel, without the video at the end. And yeah, you can have a look at it, share it with other primary care practitioners or with consumers.
Yeah, and if I can just add, I think if it hasn't already been sent out, there will be a link sent out to the particular part of our page where there's information for practitioners about the My Rights, My Decisions form kit. So it summarizes the form kit, and then it has, we already mentioned, like you can download the form kit, and the two handout fact sheets are specifically for how can a GP support a person completing the form kit. So that's a useful resource that people can use.
Yep. Thank you. Yeah, I think we've done for questions tonight. I monopolized that bit. So thank you so much, Terry and Petra. It really was great and very, very useful. And we'll look at trying to promote the form kit more and try and do further education events with you. So thank you very much. Thanks. Good night.
Great. Thanks. Good night, everyone.